So with that, I will welcome Derek Moates. So Derek is a researcher and lab manager for the UAB Department of Pathology's Fungal Reference Lab, which has been instrumental throughout the pandemic. The lab worked closely with UAB hospital labs and private sector biomedical companies to scale up and support the Guide Safe Entry testing program last year. The lab has also worked with the Alabama Department of Public Health to sequence positive COVID tests to determine which variants of COVID-19 are here and which variants are the most prevalent in the state of Alabama. And that's what Derek is actually going to be here to discuss with you all today. So Derek, if you want, you can go ahead and share your opening statement. So I'm going to go ahead and pass it over to you.
All right, thank you so much. Thank you so much for joining us today. My name is Derek Moates, and I'm the lab manager at UAB's Department of Pathology's Fungal Reference Lab. Each week, I analyze and conduct variant testing on random COVID samples from hospitals all across Alabama. Today, I'm here to discuss our recent findings on the prevalence of the Delta variant in our state. I haven't been too concerned about what I have been seeing until this past week and a half to 2 weeks. Over this time period, our testing has shown a concerning increase in the Delta variant. In fact, 34 of the last 48 samples that we have sequenced, or 70.8%, were the Delta variant. Again, 34 of our most recent 48 samples sequenced are the Delta variant. We have found that this strain has an increased viral load that is much higher than the previous strains. A high viral load means that the variant is producing a very large amount of virus in an infected individual. The amounts that we are seeing now are higher than any we have seen before. This means that this strain is extremely contagious and is spreading rapidly. Unfortunately, these high viral loads combined with low vaccination rates are creating a potentially very dangerous situation for our state. And the only way to stop it from progressing is to get vaccinated. What our recent findings here at UAB tell me is that if you've been on the fence about vaccination, now is the time to do it. Vaccinations are key to protecting everyone from potentially serious health complications brought on by the virus. Complications that can result in the loss of taste, smell, heart or neurological conditions, and yes, even death. If you are eligible for vaccination and you still have questions, please talk to your physician. And if you are ready to be vaccinated, I encourage you to go to vaccinefinder.org to find a location nearest you and get an appointment as soon as you can. Thank you. And with that, I'll take your questions.
Okay, great. Thanks, Derek. All right, so first we're going to start off with a few submitted questions that we have gotten in. So Tyler, if you'll name off a couple of those questions, that would be great, please.
Yeah, sure. Thanks. Thanks, Anna. So Dr. Moates, Mr. Moates, you mentioned that 34 of the recent 48 samples that you've tested were positive for the Delta variant. Can you just sort of explain the difference in those numbers versus what you were seeing in, say, late May and most of June, and I guess even throughout this year since we started vaccination, just how this makes the current situation a little bit more acute?
Yes, definitely. So we originally started sequencing. We did our first initial sequences at the very end of December, just testing out our instruments. And then we actually began looking at samples starting in early January. Shortly after we got started sequencing, we found the first UK variant here in the state. And that was around January 26th. And then we continued sequencing, looking at samples. And then we also found the South African or Beta variant in April. And then we started seeing C37. And it looked like C37 was going to be taking over as many times as we were seeing it popping up in the sequencing. And then at that point, shortly after, we started noticing the Delta variant pop up, and that was in late April. And what we had was late April, we had our first case, and then we had our second case mid-May, and then our third case in late May. And then around the middle of June, we had our next 3 cases all at one time. And then it was about a week or two later, in another batch of samples where we had 11 out of 16. So we had a huge increase in the number of positives for Delta variant we were seeing. A week later, another 16 samples, another 11 positive. Then shortly, right after the 4th of July holiday, I started another sequencing batch of 16, and we had another 12 out of the 16 show up. So what we've seen over time is a very rapid increase in the number of Delta variant cases. And we've been able to identify those by seeing the high viral loads in the sample, which helps us select which samples we're actually going to sequence.
Okay, thank you very much. The next submitted question comes from Ramsey Archibald with AL.com. And he dropped this in the chat. But, Dr. Gepfert, Dr. Paul Gepfert here at UAB, who's an expert on vaccines and was an investigator on the J&J clinical trial. He had mentioned last week that he is worried that Alabama is going to have the next variant that's going to be completely vaccine resistance, just largely due to our poor vaccination rate. So Ramsey's asking if you agree with that assessment, and if so, what is it about Alabama's current situation that makes it a good breeding ground for potential new variants?
Unfortunately, I do have to agree with him. What we're seeing is with this increase, we have around 33% of our population vaccinated, which means we have a large percentage that is not vaccinated. With the Delta variant, we're seeing each person who is infected with the Delta variant, they have high viral loads, which means that they're able to easily infect people that are close to them in less than a minute. Whereas with other strains of the coronavirus that we've been dealing with, you could be around them for 10 to 15 minutes in a room before you actually would contract the virus and become actively infected. With the Delta variant, it's different. It's much faster because the viral load is much higher. With that, a lot of these Delta variants have been identified shortly before the 4th of July holiday. And then we had our 4th of July holiday. We were all gathering with our families and our friends. The mask mandate is gone. So most people were without masks, and which made it easy for the Delta virus to spread. This spreads to both unvaccinated people, and then the unvaccinated people, as they become ill and are spreading more virus, they're going to come in contact with vaccinated people, exposing vaccinated people to the virus. The Delta variant does have some mechanisms to kind of help it get around antibodies that have been produced against the virus. So there is a little bit of susceptibility. It is not 100% effective. The more opportunity that the virus gets to get into an individual who's vaccinated, it gives them the opportunity to learn how to get around our immune system so that it can actually defeat the vaccination, which is what we do not want. We've worked so hard in order to create the vaccine, and it's so effective, and we've seen such a decrease in a number of our cases, but because we haven't been compliant with everyone getting vaccinated, we've left the door open for the virus to learn everything it needs to get around that vaccine that we desperately worked so hard to get.
So Derek, I'm going to get to you, or we'll get to you in just a second too, Alan. I'll let Anna get things over to you in just a moment. But Derek, you explained this really well when we were talking the other day too, about how you looked at it kind of like playing a video game. Can you kind of give that analogy of just what the virus does and sort of how you compared that to playing a video game? I thought that was really interesting.
Yeah, so the way I like to explain it to people is you've got an RNA virus, and this virus is out there and it gets inside of you and it starts replicating. So when you're playing a video game, the first time you play it, you're not going to be very good at it. You're not going to know all the tips and tricks you need to get through and be successful and win the game. So you play, you come across something, it kills you. You learned, I know that there's someone behind this corner, or that there's an obstacle here that I need to be prepared for. So the next time you play, you get to that point and you inactivate whatever you need to, get around it and move forward. And then you may encounter something else that you didn't expect, you die. You play it again. So every time you play, you learn a little more and you can get further in the game. The virus is doing the same thing inside of our bodies. As it interacts with us, it learns how to get around. And because the virus is also mutating simultaneously as it replicates, it's trying out multiple different versions inside of us to see which one actually works. So it's playing a game with us. And the only way that we can prevent it from playing the game is by getting vaccinated. And if you are unvaccinated, by using social distancing, hand washing, and mask wearing when you're in public and enclosed areas so that we can stop the spread until we get it actually under control.
Thank you. And then Alan, I see where you have your hand raised. Do you want to go ahead and ask your questions?
Yes, Mr. Moates, I was wondering if you were sort of talking about there, and we heard this from Dr. Moates. Why is the Delta variant so much better, how it's constructed to spread quickly and to move be much more contagious for us?
The easy answer for that is the amount of virus that's being produced with the Delta variant. So when individuals are infected with the Delta variant, they are producing excessive amounts of virus, way more than we've seen with any of the other variants. So one of the things that I look at when I'm screening samples to determine which ones we need to sequence, we look for high viral loads with low CTs. So what that indicates to me is that, okay, if it's got a high viral load, most likely it's going to be one of two things. It's either going to be possibly a variant, or it could just be an individual who has a weak immune system and can't really fight off the virus. So either case, we want to sequence it and find out. So what we're seeing is huge volumes of virus in these individuals. When you have a lot of virus and you have high viral loads, just the act of breathing loads the air with lots of virus particles, making it so much easier to infect individuals who are close by and in the room. So it's due mostly to the sheer volume of the amount of virus being expelled by individuals who have contracted the Delta variant.
You mentioned that vaccinated people who, we're vaccinated, we go out, we've been in crowds, no masks, no social distancing, but we're at risk. Are you suggesting that perhaps we need to keep the mask and social distancing for being exposed to the Delta variant, which could be a problem?
People who are vaccinated are safe without the masks, but we always want to be cautious, especially with these new variants, because we do not know what to expect. And because of the lag in sequencing time, we're actually looking at a snapshot that is from a week to 2 weeks prior when we get all the sequencing results. With vaccinated individuals, they tend to be fine. The vaccine is effective and it works really well. Most cases where individuals who have been vaccinated have contracted the Delta variant or one of the other variants, it's usually due to they're immunocompromised individuals, they're elderly, or have comorbidities, which make it harder for them to fight off infections in general. So those vaccinated individuals may want to take extra precautions when they are in crowded places, enclosed in areas with lots of unmasked people. They may want to go ahead and just wear their mask just for that added protection, since they do have problems with fighting off infections in general.
All right, thank you. And then Ramsey, I see where you have your hand raised. If you want to go ahead with your question.
Thank you, and thank you for answering our questions today. You kind of just touched on this, and I just want to make sure I have a full understanding. You said that these sequences are kind of a snapshot of 2 to 3 weeks ago, and from my understanding from what you said earlier, you're doing about 16 per week, is that right?
Well, the interesting thing about this and why it's concerning is we've been sequencing for a while. We were making sequencing runs anywhere from 2 to 3 runs a week, and we do 16 samples per run. After vaccination started, they slowly started decreasing. So although we would be able to identify some positive cases, the viral loads were not high enough that we could actually get good sequencing on the samples. So then it became a struggle to actually find samples to sequence. So we've gone for about a month and a half with only doing one sequencing run of 16 every week and a half, because we just couldn't find enough samples that were positive with enough virus. Then about 2 weeks ago, we started noticing a increase in the number of samples that have really low viral loads. I mean, really high viral loads or low CT values. So those became kind of a red flag that something's going on. Why are we having so many people who are testing positive and they are having high viral loads? And the answer to that question turned out to be that it's Delta virus, the Delta variant. They are all carrying the Delta variant. So it's looking at the viral load is what has helped us to actually track, trace, and then identify the variants.
Cool. So so I have a clear picture, those 48 cases that you mentioned that where 70% of them or whatever were Delta, can you give me a time frame of when those came from, knowing, of course, that there might be a lag from when they were actually taken as well?
Yeah, so let's say the first 11, I think, was around June 29th or so. Then we had July 7th, it was another run of 16 where we had another 11 variants. And then July 8th, the day after, I had another batch that I ran of 16 and we had 12 out of 16 in that run. So right before the 4th of July holiday, we didn't have a ton of samples. We were getting enough that we could do a couple runs. This last week, I was running samples, sequencing samples 3 times during the week. And then I had another run that was set up first thing Monday morning. And I'll actually, by the time we finish this, this interview, it will be finished, completed, and I'll start analyzing those sequences.
Thank you.
All right, Robert, I see where you said you had a question, but weren't able to raise your hand. So if you want to go ahead with your question, that would be great.
All right, let me unmute myself. I'm sorry.
Robert, we can't hear you. You want to try your question again?
Let's try that one more time. I'm not having a good morning with tech this morning, so bear with me. Thank you. 2 related questions. One, we're right in the middle of summer travel season, everybody headed for the beach. Obviously, there's concerns when people are gathering in indoor environments, but a lot of what we do this time of year is outdoor. Is there going to be possibilities of spreading this new Delta variant among the unvaccinated during such outdoor events? Let's say just going to the beach or a concert or something like that. And the second question is, for those of us that are vaccinated and not in the elderly or otherwise compromised conditions, how concerned should we be that this Delta variant is going to break through and possibly infect us despite having the full vaccine regimen?
Okay. So on your first question about summer and being vaccinated and unvaccinated and being outside in public, normally with some of the earlier variants, being outside, if it's not a very crowded venue and you've got a lot of good spacing around you, you're not in a tight-knit group, having conversations, generally that's a much safer way. But because the Delta variant has such high viral loads, you know, I would be hesitant to really be around a whole lot of people, even outside, especially because most of the time when we have summer events, we're usually packed in pretty close together. Now, if you're doing like a family outing at a park or something like that, where you're all out and about, spread out, running around, playing, probably not as concerning as, say, something like an outdoor venue or someplace that's really crowded. Those places you may be able to still pick up and contract the Delta variant from asymptomatic people who haven't realized that they're infected at the moment, just because of the sheer volume of virus that they are expelling. And on your second question, I'm sorry, what was your second question again?
Hang on, my second question was, you mentioned earlier about those who have had the vaccine but may otherwise be compromised, have immune system compromisations, or be elderly, that they still may be susceptible and need to exercise cautions like wearing masks around people. How about those who are not elderly and not in a otherwise compromised situation? Are we getting to the point where it's, even though we've had the full vaccine regimen, that it's time to mask up again?
I wouldn't say so yet. We're still looking at the data. We're trying to sequence as much as we can, and we're monitoring all the different populations of people to see who's developing the Delta variant and how rapidly it's developing. Because if we start to see that in our elderly population and possibly healthcare workers who were among the first people who were vaccinated, if we start seeing more vaccine breakthroughs in these individuals, then that would be concerning, because then that may indicate that this particular variant has found a way around the vaccine. And at that point, there may be some advice out there to go ahead and mask up just for safety precautions, even if you are vaccinated, but we haven't reached that at this point. But I know that people are actively monitoring the situation. They are looking at these early category groups of people who did get the first vaccinations, because if the virus is going to be able to get around most of them, it's going to be, we'll notice it first in those populations.
All right, thank you, Robert. Thank you, Derek. Sarah with AL.com, I saw that you have your hand raised, so go ahead and ask your question.
Thanks. So I'm wondering if we can draw any conclusions about the prevalence of the Delta variant overall in cases, given what you've seen. And I know you're looking for viruses with people with a high viral load. So I wonder, when you identify those and test them, how that correlates to like overall prevalence of the variant.
Well, I mean, when we're looking for stuff to sequence, because we are specifically looking for variants, so one of the things that we'll look for is a high viral load, because it kind of gives us an indication that this may be someone who is carrying a variant. So the data can be skewed a little bit in that regard. But when I look overall, we had a trouble finding cases to begin with that were actually sequenceable, that had enough virus in them. We were just getting people who were positive, mildly sick. It wasn't too bad, didn't have a lot of virus. And now we're seeing viral loads like we've not seen before. I can tell you, like the last run I had, normally, so we have what we call the CT value. And that kind of gives us an indication. So a CT value of 30 or less means there's enough virus in the sample for us to sequence. Most of the stuff that we've been sequencing, we're looking at the mid-20s for a CT value, which is a very decent viral load, and you're pretty infectious. Occasionally, we would get viral loads where the CT value was in the teens. The last sequencing run, I had probably 80 to 90% of the samples where the CT value was in the teens or extreme low 20s. So that's a huge shift in what we have been seeing, which is why it's concerning, because we don't have a lot of people who are vaccinated. And now we're starting to see that we've got a lot of people who are infected with the Delta variant, who are producing large amounts of virus, and then they're going out and spreading it without realizing that they're doing so until they finally get sick enough that they go and get tested.
Could you estimate like what percentage of cases in the state are the Delta variant?
It's hard to say right now with the information that I have, because we get our samples from a variety of sources across the state of Alabama. And we also get very specific cases. So we have physicians who have complicated COVID cases and they want to see if it is a variant. So we get those sent to us for sequencing. So we get a mix and variety, but we do kind of try to cherry pick the samples for sequencing because we are looking for the variant. But we have actually been sequencing all the positive cases that have been coming through, because every single one of them have a high enough viral load that we can actually do the sequencing, which that is not how it has been for us since we started sequencing. We usually have a large group of positives, and of that large group, we have a very small amount that we're actually able to sequence. Currently, I'm able to sequence probably 97% of the positive samples that I've seen.
All right, thank you, Derek, and thank you, Sarah. Chip Scarborough with NBC 13 also has a question. He says, we have the Delta variant now. What's next, and how often will the virus mutate?
What's next? I would love to say that COVID is gone and we can all return to a much more normal life. But right now, that is not the case, and we can't say what's going to come next. With our low vaccination rate and this rapid increase in Delta cases, I fear that there could be a new variant that is actually formed here in Alabama, because we have so little compliance with vaccination. And now we have the worst case scenario, we have Delta variant spreading community-wide now. So it's community spread, and that in itself is an issue. And that creates that opens the door for opportunity for the virus to learn and get around vaccination, which then puts those of us who have been vaccinated, puts us at risk as well. So we're trying to prevent that by encouraging as many people to go and get vaccinated as possible, because we want to prevent this from getting any worse and progressing any further. We don't want to see any more variants.
Thank you. And then Alan, I see you have your hand raised. Go ahead.
Mr. Moates, probably an unfair question. How would you describe the situation where we are now? Is this a crisis? We're on the border of a crisis? Are we months away from winter and such where we are expecting a big increase? That'll be the crisis. How would you describe where we are and how and where we're going if things proceed as you are now seeing with your evidence?
It's really hard to project. This is one of those things. This is an unfolding a situation that we've been dealing with for a year and a half now. And as we've seen, every time we think that we've seen, okay, this is bad, here's the UK variant, it's doing its thing, oh, it's the worst of them, then we start seeing the other variants starting coming, and each one is progressively just a little bit worse and a little bit more contagious. I don't want to think about what the next step is after Delta. I'm hoping that we're able to get enough people vaccinated so that we can prevent the evolution of this virus into something more heinous than what it currently is, which is pretty bad already. So it's hard to really project. We're doing everything we can. We're keeping on top of sequencing. We're tracking everything we can in hopes that we can give the public enough information so that they can protect themselves and stop the spread. Because even if you're asymptomatic, like I said with the video game analogy, anytime a person gets infected, that's the virus playing the game one more time. That's another opportunity for it to learn how to get around our immune system and the antibodies we produce, whether naturally through infection or through vaccination. So we're wanting to prevent that. In order to stop the virus from being able to play the game and learn how to get around everything, we need to have people vaccinated.
All right. Thank you. And Ramsey, go ahead.
Hey, so this may be a more of a question of how your work kind of works behind the scenes a little bit. So when you're sequencing these viruses with these positive tests with high viral loads, are you specifically looking for the variants we know about? And if there is a new variant, will you see that? And is that you guys who will find that if there's one that comes up in Alabama, it's brand new? Or how does that work exactly? Does that make sense?
Yes. So what we do is we extract the RNA from the samples, And then we put them on our sequencer, and the sequencer reads it like a book. It tells us exactly what's there as far as its genetic sequence. Then what we do is we go through an analysis of the genetic sequence. We do comparisons against the original strain and all known strains, and we see how do they line up? Do they have the same mutations? And then that lets us know which particular strain or variant it is. Now, when we see certain mutations, especially like in the spike protein, and they're not ones that we've seen before, that's an indication that we may be looking at something new. When we find something like that, then we try to get samples like those over to our research labs where they can propagate the virus and then do studies on it to see, is it more infective? Is it deadlier? Is it more contagious? And we have to characterize it. So what we do is we get that sequence, and then based on that, we'll be able to determine whether it's a new variant or not. There are some places where they've actually named new variants. I believe Texas had one several months ago that they named. You have to have several of those cases that you come across in your state before you get the opportunity to name it. So just because we see one sequence where it looks like there is something going on and it may be a new variant, we would have to see a couple more come in that we can do comparisons to before we would be able to determine that.
All right, thank you, Ramsey, and thank you, Derek. Derek, I've got a couple more questions, and then if there are any final media questions as well, feel free to raise your hand. We'll get to those after these two, and if not, then we'll close up for the day here. When you sequence the samples, can you tell a difference in how vaccinated individuals typically respond to these variants? Is there a way that you know whether a person has been vaccinated and just sort of how the vaccine works to stop these variants from getting too severe?
Well, once you get your vaccine and you've gotten both of your doses and you're 2 to 3 weeks out from your second dose, your antibody titers are extremely high. So you're very well protected against most of the variants. The individuals who do have these what we call vaccine breakthroughs, where they've been vaccinated and then they end up contracting coronavirus, they typically have a simpler course so they are not as sick. They don't require hospitalization, ventilation. It's more like a cold or mild flu, and then their body recovers quickly because they already have some antibodies that are semi-functional, so they're able to overcome that, and then their body produces new antibodies specifically to the spike protein on the Delta variant or any other variant that they're seeing. But the most important point is vaccinated people who end up contracting the Delta variant would not have a more severe case.
And going back to vaccinations, obviously that's, the struggle now for the state is just the hesitancy part with the 33% vaccinated. You have a unique vaccine story that you sort of shared with us yesterday. Would you mind just sort of sharing your own hesitancy that you had about this particular vaccine and what led you to go ahead and get it?
Yeah. So back in August of 2019, right as the pandemic was starting underneath everyone's noses without any of us realizing it, I had to get a vaccination for the work I was doing in the BSL-3 with monkeypox. So I had to get a smallpox vaccination. Read everything on it, knew that it was going to be uncomfortable. It is a live vaccine that you're given, so you actually do get a smallpox pustule on you. All accounts, you're just going to have some tired, you're going to have a oozing sore within 3 weeks or so. It's sealed up, it's gone away, you feel fine, and you're protected against smallpox. Unfortunately, I was one of those 1 to 4% of individuals who have what's called a robust reaction. And it literally took up the entire deltoid region of my left arm. I was extremely exhausted. I had an oozing sore for weeks. I couldn't even go into work because I was contagious and could give other people, they could also contract it from me. It was extremely uncomfortable. I was not thrilled with the experience. And then COVID hit, and then we started talking about vaccine production. And immediately in my mind, I'm like, I don't want this. Like, I don't want the vaccine. It's soon. I had concerns myself, and a lot of it was from the fear of the vaccination that I just had. Two totally different vaccine types. One is a live virus, the other one is an mRNA. But I had to, self-evaluate, and I had to stand back from my fears that I had, and I had to look at the science, the data, and the facts. And when I did that, I realized that the most intelligent decision I could make was to take the vaccine, because being a scientist, I understand the mRNA vaccine, how it works, how it's effective. And then I just went and signed up immediately and got my shot. And 2 weeks later, got my second shot. I had a little bit of drowsiness, didn't feel great. Woke up the next morning, felt completely fine, and I've been fine since. So I understand vaccine hesitation from my own personal standpoint, and I understand how people can be afraid because it's an unknown. But when you look at it, we've all had multiple vaccinations in order to go to school. We take a flu vaccine almost every year. A large portion of the population does, because we want to prevent flu infections. And it's the same thing with COVID. This is a very safe and effective vaccine. I think it's much safer than the flu vaccine, because we don't have anything like egg products or any types of major allergens in this vaccine. So it's in much fewer reactions and much safer. So we just need to, hope that everyone will sit down, talk with someone who understands the vaccines, answers their fears, gives them facts to help them understand, and then hopefully they'll make the right decision and either vaccinate themselves, or if they just can't overcome that, they will at the very least, do social distancing, wearing a mask, and washing their hands, especially when they're in crowded public places, so that we can stop the spread of the Delta variant. We do not want the next variant to come from Alabama, because we have been complacent in our vaccinations.
All right, thank you very much, Derek. And we did just drop some B-roll in the chat as well of Derek working in the lab here. So, and we'll be sure and send that out later as well. Anna?
All right, so it looks like we don't have any more questions. So with that, just want to say thank you all again for attending this session today, and we will work on getting this downloaded and distributed to everyone shortly.